Hello everyone, myself Dr. Pula Naveen Kumar, Senior Consultant Urologist and Andrologist at Ritvik Kidney Center and Androcare, located at Habsiguda, Hyderabad. Today my topic is Overactive Bladder. Struggling to control the bladder is the overactive bladder. I'm going in detail about the overactive bladder, definition of the overactive bladder, causes of the overactive bladder, what are the symptoms, how we'll diagnose, and what is the treatment, and what are the lifestyle modifications required for overactive bladder, and what is the latest treatment methods for OAB. Sudden uncontrollable urge to urinate is the main sign and symptom of the overactive bladder. Overactive bladder is a condition where the bladder muscle contracts uncontrollably, causing a sudden and urgent need to urinate. This can lead to involuntary leakage and significant impact on the personal quality of the life. The sudden urge to urinate that may be hard to control, that leads to leak. It's a problem with the bladder function. It happens most commonly in the women, but it can be seen in men with aging, especially due to enlarged prostate and men with diabetes. The most common cause is the neurological conditions like Parkinson's disease, multiple sclerosis, stroke that leads to damage of the nerves that controls the bladder, leading to OAB, and muscle weakness and weakening of the pelvic floor muscles can contribute to the overactive bladder and incontinence. Apart from these, foods like excess fatty foods, drinks having excess caffeine, carbonated beverages can lead to OAB-like symptoms. Some other causes include menopause, old age, especially with diabetic patients, smoking and alcohol. Patients with the bladder stone can have the symptoms like overactive bladder. Along with this urinary urgency and urge incontinence, they will have the painful urination. So patients presented with frequent urination and urinary urgency, and they are, along with this, if they have the painful urination, will have the suspicion of the bladder stone. Another cause is a cystitis. It is an inflammation of the urinary bladder caused by the infection. It also causes the painful urination along with the urinary frequency and urgency. Especially in the older age, men will have the BPH, the benign prostatic hyperplasia, that leads to the urinary frequency, urgency and urge incontinence in some patients. It is also secondary cause for the overactive bladder. In a nutshell, the symptoms will include the frequent urination, both the day and night time, and bladder muscle squeezes suddenly without warning, bedwetting, urine leakage, urge to urinate frequently. This leads to urinary frequency both the day and night time, 6 to 8 times per day. So how we will diagnose the overactive bladder? We will have the video urodynamic study. In this, we will put the small catheter into the bladder. We will fill the bladder with normal saline, and we will put the sensors in the perineum, how the muscles and how the nerves will react. Once we are filling the bladder, so we'll see how the bladder muscle is reacting and how the sphincter muscle is responding. When it shows the urgency, urinary urgency, all will be known in detail in the video urodynamic study. Another one is the bladder diary, tracking the urination patterns of an individual to provide the valuable information for the diagnosis. So apart from that, we will take the medication history and we will do the physical examination, especially neurological examination of the perineum, that will give us clue of the involvement of nerves. What are the treatment options? We have the different treatment options. First one is the lifestyle modifications, like making adjustment to the diet, fluid intake and regular exercise, 𝐂𝐬𝐿 exercises for the pelvic floor strengthening, medications, especially we have the good anticholinergic medications now with less adverse effects, sulfenacin, darifenacin, mirabegron. Latest one is the mirabegron. It is anticholinergic that decreases irritation of the trigon area so that the frequency, urgency, and urinary incontinence will be come down with these medications. Stay hydrated, manage diet, exercise regularly, and bladder training, bladder dairy maintenance is a key factor. We have the few latest modalities for the overactive bladder. The cystoscopic guided radiofrequency ablation of the trigone area, intravesical injection therapy with the botulinum, and sacral pudendal nerve neuromodulations, and research method is stem cell therapy. So whenever you have this urinary frequency, urgency, urgent continence, you should have the suspicion of overactive bladder. When you visit the physician regularly, when you do the ultrasound abdomen, if the patient doesn't have the BPH, don't have the bladder stone, no cystitis, no underlying cause will be there, then in this case the primary neurological overactive bladder will be the main cause. If you visit urologist early with the few lifestyle modifications and with few medications, symptoms will subside very fast. Thank you.